Vaccination of cancer patients should be a priority. There are two important aspects that involve COVID-19 and cancer. This pandemic year has demonstrated the direct impacts on the diagnosis and care of cancer patients. Data from the United States show that, from March to May 2020, 100,000 cases of cancer were left undiagnosed because Americans simply did not attend routine consultations. These are tumors of the intestine, lung, breast, cervix, and prostate that have not received treatment. Because of the late discovery, cancer mortality this year is expected to be 20% to 30% higher there, compared to 2019. Here, several medical societies have already reported a drop in screening tests last year, with reflexes that will be census soon. In other countries as well as in Brazil, many patients already diagnosed have delayed their treatments for fear of leaving home. So, as I have already written on this space, I reinforce that it is important not to change the health routine due to the coronavirus. We already know that, for those who have cancer, the risk of a coronavirus complication is greater, especially if the patient is undergoing chemotherapy, if he has a lung tumor or malignant hematological disease, or if the disease is very advanced. Therefore, what should change is the degree of attention and care, with the maintenance of social distance, hand hygiene, not sharing personal objects, and the use of masks. And, certainly, along with this responsible posture, immunization. Why vaccinate cancer patients? Vaccination is welcome and completes pandemic control strategies. With hospitals at the limit, it is seen as a fundamental action to reduce cases of COVID-19. Unfortunately, we still do not have an order of priority for cancer patients, ideal for the aspects already mentioned above. The age criterion is respected. So, when you reach your age group, do not waste time. Get vaccinated. There is no contraindication for vaccine doses currently available to be applied to people with cancer. Unlike other situations, such as the yellow fever vaccine, which has the virus attenuated, the vaccines available at the moment have the virus inactivated, coronavac, or a viral vector that does not replicate, Oxford/AstraZeneca. Even if the patient is undergoing treatment, there is no risk of infection. In fact, the question that still persists is about the effectiveness of the vaccine, which, sometimes, depending on the tactic used against cancer, may be less. Chemotherapy, for example, can decrease an individual's immunity and can prevent antibodies that are strong enough and so protective to be produced. Therefore, the recommendation is for the patient undergoing chemotherapy treatment to talk to the doctor to assess the case and the possibility of changing the cycles to receive the immunization. There are still no specific studies on coronavirus immunizations and efficacy in people with cancer. But some vaccines, such as influenza, have shown that patients who use immunity-lowering drugs may have a slower development of antibodies, such as carriers of blood tumors, such as lymphoma and leukemia. The danger, eventually, is not to produce as many antibodies or as efficient a defense. But they are still hypotheses. The most important thing is not to have contagion or to worsen your health condition due to a new serious infection. Another major concern is the side effects. From our office experience of the patients who have already been vaccinated, there was nothing different than usual. In general, no symptoms are reported and, when it appears, it is mild and transient. But for those who have not yet been vaccinated or have already received the doses, I insist, the rule of maintaining alertness is valid. Even for those who have had the coronavirus infection, it is recommended to take the vaccine. Antibody levels can drop over the months and immunization can protect against other variants that may eventually appear. Take cover. Individual care is the care of everyone. You heard Gericast, a Brazilian podcast about longevity and health. Production and creation: Williams Fiore.